Hello, it's Jennifer Shepard, your integrative manual physical therapist. And what do plantar fasciitis, urinary incontinence, hamstring tightness, foot tightness, leg pain, quad weakness all have in common? Your lumbar spine and pelvis, and its mechanical alignment, its stability, and when it is just off kilter, it is not stable and it is irritating. I say this, I have my own project as well. I have my own history of injuries and illnesses and traumas that I also am working to overcome and to optimize so I can be as healthy as I can, as long as I can, to live a vibrant, resilient life. Your mind brings again and all of you. So I've been working hard in the gym. And I've been working with the deadlift. And if you know me, the deadlift is the kiss of death. And that's where a lot of my patients get into trouble when they come in. Oh my gosh, I've got this leg pain. Hey, actually, what'd you do 3 days before? Often here's the deadlift, right? They some sets. Or, hey, my back just went out. Well, what'd you do a couple days before? It was a deadlift. So more often than not, that deadlift is a player in being very provocative to a lumbar spine. And most of us do not have healthy lumbopelvic mechanics, even in our young people, our teenagers, our high school people. So I've been working this very, very, very gently with an amazing trainer. And out of the gate, I'm like, cautious, 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 because it doesn't take much to take off my L5 disc, an L4 disc. I've got some significant damage there. I've done some prolo PRK. I've taken really good care of it, and I know what I can do, what I cannot to do. But I've been really excited to learn how to move my body more effectively and more efficiently under a really guided eye. So I've been making some beautiful progress. When I first started this, I'm like, yep, it's tripping down my leg. I gotta back off. So we worked to help me stay out of my lumbar spine into this healthy. I'm going to tell you, most people probably are not doing this effectively and healthily for their low backs. So we just started to bump up the work, which I was excited. I'm like, hey, I'm excited to go a little further. I'm excited to get a little stronger. And it increased the repetition. And I'm working really hard for my form, trying to stay on my back. And I did okay during this new workout. And the next couple of days, wow, my legs are really, wow, my butt hurts today for my hip. Wow, I'm really struggling with my squats. How can I stretch the right quad? Realizing, hey, I pushed a little too hard. So too far, too many reps on this very delicate lumbar spine. I backed off. I went into treatment, and my treatment is mobilizing my lumbar spine, restoring any mechanics, because many of us have a little sloppy, they say that lovingly, a little sloppy L4, L5. And that's because we're stuck above and below. And it often becomes the only avenue, not the only, but more forces are subjected to that area because areas are stuck above and below, and the body will always try to find a place for movement. So most of us have a little extra stability, a little extra play where it doesn't take much for things to shift just a little bit. And this isn't a huge subluxation. There's such controversy about subluxations, but what we feel with our hands, sometimes vertebrae are shifted just a little forward. And when they're pushed really far forward, that is called a little like this, when that vertebrae is forward. So and we see this all the time in the clinic. When that vertebrae is forward just a little bit, it throws off the alignment. We don't have optimal alignment through the hip, knee, and foot. It irritates that nerve root just a little bit. It irritates the disc, which also could irritate the nerve root. It narrows the space of the foramen because we're not in optimal position and alignment. It also can affect the nerves and muscle-like tension of the bladder and the pelvic floor. What I have noticed in my body, and I notice this in other people, and I really want to point this out because often we're treating the wrong area, and maybe not the wrong area, but we're not treating the entirety of what the body needs. As I did this big workout and I irritated my back just enough, my back was never sore. And people tell me, Jen, my back doesn't hurt. But did it ever hurt in the past? It did. Yep, we've got some underlying mechanics underneath there that are not efficient. And yes, it's quiet, but those inefficient mechanics are driving on the face, as people have seen before. Hamstring pain, pain in their legs, tight gastrocs, plantar fasciitis, incontinence, pain, knee pain, all of it. So much of it drives from the lumbar and above. What I've noticed in my own body is first thing in the morning, I'm like, wow, that left heel is pretty tight. I haven't felt that plantar fasciitis chatter in a long time. Yep, there's my lumbar spine that's irritating. Just enough. But my back doesn't hurt. But those mechanics irritate the rest of the body. So I just was playing tennis today, and I'm still nursing this irritated lumbar spine. So I've done this workout a week ago Wednesday, and it's still a little grouchy. Like when I go into a squat, wow, I feel that quad with my issue too. Yep, that's continuing. I was playing tennis today, and my core bladder could not be mine. All of this tells me, number one, I need to get back to my stability. And as I'm doing this gym workout, getting strength, I have neglected my deep core stability. I've neglected my foundations in my structural health. I've neglected my base and five. I've been foam rolling a little bit here and there, but I have not spent my time on my floor to make sure that my core is turned on, operating as base. I've not been getting into my bridges to make sure I've got stability, optimal length, and optimal alignment. I've not been into SWAT to make sure I pull everything together. So I've been working out a little sloppy. I haven't come at neutral stability. So I can't stress enough. My multiple points here are when we have other things, lower extremity, pelvis, we've got to look the pump. What's going on at that lumbar spine? Very likely, almost always, there's stuff going on that we need to address mechanically, even though there's acting like theory. And then it's not enough to only treat mechanically, because that's what I did. I treated mechanically. We have to make sure we reinstate the deep stability. And this is not crunches. This is not dead bugs. This is not planks. This is not leg lifts. That is not going to restore this deep internal stability, that for the lumbar spine and pelvis in order to keep all of those structures healthy. And make sure you come over to the Foundations for Functional Health. I'm talking about all of these things over there and go through a very, very specific order in which I teach you how to address the length and mobility of your body, the entire body, to restore length, restore alignment, make sure you're in optimal alignment. And then I teach you systematically how to stabilize throughout the entire body. So for a full body, is in a better alignment, better stability, and we're healthier, we're much more stable from the inside out. Our core is kicking in solidly to protect, so we can go out and play tennis and go lift a knee, play baseball, all the things we wanted to.